Hi, I'm Joe Carraro. Why does it seem like it's always all of them against us? You know, Obamacare came about because the system was very sick and needed a cure. And while the president's name is attached to it, we know that it was the Democratic leadership in Congress who put together a cure that seems more like chemotherapy for a broken leg. It doesn't solve the problems it was supposed to. It makes the patient, us, suffer needlessly, offering a future that will look back on an operation that was a success with the patient dying. And it doesn't seem there's anyone in Washington who understands the healthcare needs of the average Joe and Jane they represent. We've either been hoodwinked by the Democrats who proposed the need of total reform of healthcare to the point of giving into a national system that will further bankrupt our country and actually cut services to our citizens, or cajoled by many Republicans who want us to believe that their corporate interests pose no problem and need to be protected. And they all loaded up on the contributions from the special interests they covered for. Lingering problems like health care can be very profitable to those whose votes have to be sought or bought year after year. What we have at work here are those special interests on both sides of the equation, who are working the political system to improve their influence and profits, as opposed to having elected officials representing the will and best interest of us, the average citizens of our country, who put them in office. Our healthcare system is a mess because of greed, corruption, a lack of regulatory enforcement, a need of competition, and inefficiencies in delivery. It's a mess because insurance companies, pharmaceutical companies, attorneys associations, unions, healthcare professionals, and a bunch of other stakeholders are protecting their profits and positions by buying their capability to control government, regardless of political affiliations. And per usual, they can buy their decisions up front, with the average Joe and Jane paying for the implementation for the rest of their lives, and their children's lives, and their children's children's lives. Of course, we heard from the Obama administration and those supporters in Congress that most of the reform can be paid for by the hundreds of billions that can be saved by eliminating the inefficiencies and waste and corruption in government programs such as Medicare and Medicaid. If that's true, why not accomplish that now and show it as an act of good faith to the taxpayers of our country before committing all these future tax dollars to this reform? To give President Obama some credit, at least his administration has identified some $60 billion in fraud as a start in cleaning up the hundreds of billions that have been stolen out of our healthcare system because our government just pays bills submitted without having the resources to verify that they are actually providing goods or services to our populace. All these years, all you had to do was to submit a bill and get paid. And the system was so lax it actually encouraged people to steal. And it's not like those in Washington didn't know. It makes you wonder whether those folks or these folks representing us are just lazy or part of the corruption they allow. And remember when these same statements were made about cleaning up corruption way back then with Hillary Care? And yet the inefficiencies, the waste, the corruption were allowed to continue for another decade with both parties in control, Bush and Obama. We wouldn't be in this mess if we would have begun the cleanup of the healthcare system back then. But it appears both Democrats and Republicans wanted all these years more concerned and with the special interests than providing affordable health care to their constituents. If we had an efficient and effective healthcare system, we'd have an opportunity to probably pay for a lot of innovation and necessary health care for our citizens. But the government needs to show us the money first. Show us the savings. Show us a healthcare system that has eliminated fraud and become efficient and effective. And before breaking the bank with extravagant change benefiting big interests and penalizing small business and the average tax-paying middle-class worker, let's figure out what we as average citizens need to improve our health care to make it work, and demand that those we send to office represent us for a change. And the first place we need to start is probably with every member of Congress immediately giving up their government-paid health care coverage. Now, some of them talk about it, and we hear about it all the time, but I have yet to see one enter a bill removing that insurance benefit so that they would have to vote on it, and we'd be able to see how they voted. In order to represent their constituents, they need to first face the same conditions that they're supposed to be that those that they're supposed to serve are facing now, and not wait until some reform takes effect. Maybe then they'll read the law and figure out what it does. And maybe that could get enough votes to repeal it. This privileged class needs to understand the dilemma by experiencing the problems. Unfortunately, the average Obama and many members of Congress have never experienced what it's like to live like the average Joe. Maybe after understanding the implications of the law they passed, the overburdening fraud that will continue to drain Obamacare, the lack of effective delivery systems, and the ever-increasing demand of non-paying participants, they'll rather consider opening a health care insurance competition throughout the country, providing for high-deductible health care insurance policies, tax-free health savings accounts, and tax-deductible individual health insurance, and remove the exemption that insurance companies enjoy from our antitrust laws that used to be there to protect consumers, but now protects the insurance industry. And maybe then they'll discover and consider offering tort reform, just for lawyers both on the plaintiff and defense side, and not the suffering patients. That would cut the cost of health care and still protect those who have been harmed by just limiting the amount lawyers can collect. And why not even consider offering warranties for work done by those in the healthcare industry as we do with other purchases in our economic system? And we better be more concerned about healthcare delivery instead of putting so much of this emphasis that we have, or they have, on the government insuring us all in a system that will only cause rationing and diminished access. We need to get the AMA out of the decisions limiting the number of students who can enter medical school and provide government grants for students who enter primary care willing to become obligated to areas of special need. Of course, once we cut the fraud and provide an efficient and effective healthcare system, if we really want to take care of our citizens' medical needs and cut the costs of insurance and have the government, I guess, involved in cost-cutting measures, we could offer our citizens free mammograms, colonoscopies, prostate tests, cervical cancer exams, and heart and stroke exams. That's what I attempted to do with the surplus we had in our state budget years ago. The governor and a majority of the legislature decided to send $100 back to each resident instead. Healthcare professionals figured that in our small state, the results in a few years would have been 10,000 lives saved and $3 billion in savings to the state. Of course, insurance costs would have plummeted, since these conditions and diseases could have been detected and treated early. Instead, it was surmised that most of the money sent back to residents would have had little impact on their lives. And so there can be a role for government in healthcare, but it's not to completely run the system by insuring each one of us. So stay alert, folks. We can continue to progress to having the best healthcare system in the world. But unfortunately, with the folks representing us, I think the worst is yet to come. And thanks for listening to An Average Joe.